In terms of concussions and protocols, how important is the nutrition towards that?
Huge. I think that it's always a missed piece, and luckily here, it's so ingrained in how we
Mm,
manage. And so the way that we are doing things now is we've honestly taken the C word out of things. We've taken concussion out of things and been like, hey, you had a tough bout. And
mm,
any person with a tough bout, right? There's going to be impact to your brain, to your nervous system. This is why you should care, right? It's going to increase risk of injury. You're going to feel off. You could be emotional. Like this could impact your life in general. So we've moved kind of toward this like brain health initiative right after 24 hours, chill. Get off your phone, get off of the TV. Don't go hang out with people. Don't drink alcohol, which is really hard after a fight, especially if you have won.
yep.
But that's going to really perpetuate that high inflammatory state. And it's not helpful for healing in general. So, first 24 hours, keep it chill. Don't aggravate symptoms. We're not trying to train or push into anything.
So this is not a paid ad, but I wanted to give First Beat a big thank you for sending me one of their heart rate monitors to test and get my thoughts on it. First Beat is a heart rate monitor that helps coaches track their athletes' performance throughout their sessions. With First Beat's platform, you're able to get a detailed analysis on every session and how that impacted your athlete's internal and external loads. It looks at aerobic performance, anaerobic performance, different measure that you can possibly think with your heart rate. At the end of each session, both athlete and coach get a detailed report sent directly to their emails, which makes it easier to have those conversations around how that session went and the intensities that you're able to achieve throughout it. If you would like a detailed review on First Beat Heart Monitor, comment a heart emoji on the comments and head over to my social media and do the same for the latest Instagram post. Hello and welcome back to PA Chalk Up. Today we have a special guest. Hi Olivia, how are we doing?
Good. How are you, Manny?
I'm good. Obviously, we can see from behind you that you also work with the UFC. So if you just tell us a little bit about yourself and how you got to where you are.
Yeah, so my name is Olivia Abdoo, and just wanted to take a second and say thanks again for having me on. So I'm a physical therapist here at the UFC Performance Institute based out of Las Vegas, Nevada. So I'm originally from Southern California. I grew up in Long Beach. I went to PT school at Cal State Long Beach, which is 3-year program after undergrad. I went to undergraduate school in LA as well. And then following PT school, I took a unique path and I went and completed a sports residency program at Duke University in North Carolina. And so, what a sports residency program looks like is you're a full PT at that point, you're licensed and all that, but you're taking a year to specialize in. There's a bunch of different specialties like orthopedics, women's health, geriatrics. It goes on, but I specifically did mine in sports. And so, the reason I did that was I always grew up playing sports. I love sports. I knew that's kind of the path that I wanted to go down. But in physical therapy school, it's not required for PT schools to teach you anything about sports. I luckily got one course where I went, but during my clinical rotations, I had some awesome instructors that worked with Premier Lacrosse League players and other athletes as well. And so that really pushed me down to getting this really specific clinical training and experience. And so when I was at Duke, I primarily worked with high schools in the area, which was totally awesome. I got really great experience working with athletic trainers, dealing with acute injury management, sideline management, practice, and game coverage. Um, Really unique to physical therapists versus, let's say, an athletic trainer. Um, so for me, it made a lot of sense to go down that path because I initially wanted to do athletic training, but the way that things are moving here in the US is you have to get a master's degree in athletic training, which is 2 years
Mm,
after after like undergraduate, and then PT school is 3 years. So sports in general, especially at the professional level, look for people who are dual credentialed, so PTATs.
mm.
But that honestly is a dying breed at this point because financially it doesn't make sense to go to athletic training school and to PT school. Um, Financially, it's not really feasible to do either of those things, right? So for me, and that's what those sports residencies were kind of created for, was to give physical therapists an opportunity to gain those experiences. And there I got a lot of one-on-one mentorship
Mm,
on how to rehab athletes, doing return to play protocols. So it was a really great experience. And while I was there, I worked a little bit in the Duke athletic training room. And there I was really exposed to our sports scientists, strength and conditioning coaches, other athletic trainers across all sports. I primarily worked with the women's volleyball team, kind of outside my residency experience, because I grew up playing volleyball. That's kind of my first and true love there. Being 5'2", it was never going to last for me, but I just lived vicariously through my athletes at this point. Um, but while I was there, just seeing that interdisciplinary collaboration at an incredibly high level, at the
mm,
Division 1 level, made me realize, like, nah, this is really where I want to be. Like, I love my high school athletes. Like, covering high school wrestling tournaments, my favorite, absolutely. But being at that higher level, that's where I wanted to be. And so following residency, I actually went and did a fellowship. So I did a Division 1 physical therapy sports fellowship. And so this is similar to sports residency. It's usually about a 1 year program. You do get paid for it. You get paid pretty shitty, but you get paid. You get a lot
like
of
a GA
experience, right?
position.
Exactly. It's very similar to that, and it's trying to give you that experience of the grind of sports for sure.
Mm,
But really, and so just to kind of rewind, like, physical therapists don't have to do a residency program. They don't have to do a fellowship to be PTs, to be sports PTs, to get into any of these fields. But for me, I wanted that clinical experience, that mentorship to really push me much quicker as a clinician, just that development to get me where I wanted to be. And so in the fellowship at the time, there's probably like 4 or 5 fellowships in the US. It's all just one person per fellowship. Now it's slowly growing. But I went to Wake Forest University to complete that fellowship. So I stayed in North Carolina for a year. And there I was with the football team every practice, traveled for every game, taping at 4:45 in the morning,
mm,
and then working in the training room, working with Division 1 collegiate athletes, and then I also worked in a sports clinic outside of that. So how I explain it is residency makes you like you should be able to treat athletes. It makes you a sports certified specialist. You're supposed to take the test at the end, get your letters, at the end of your name and stuff. But fellowship is, how do I interact and collaborate and contribute to a high level interdisciplinary complex environment, um, which is what I wanted ultimately. So working with physicians on top of your athletic trainers, strength and conditioning coaches, your sports scientists, your nutritionists, your dietitians, your sports psych, academics, right, and collegiate. I mean, that was huge, especially when we dive into more concussion stuff. But
mm,
that was really the goal of fellowship, was to be able to do that. And I got incredible experience, great mentorship there. It really set me up. But while I was there, I kind of reflected and realized, I've done, every step in my career has been harder and more outside my comfort zone and a higher
mm,
level. So to me, it made sense to try and get into the pro setting because I'd never been in it. So how would I know if I liked it or not? So, because the fellowship was coming to an end, it's only a year, I had to find a job. And to be honest, it's not like the greatest like sports getting in like story that you hear, right? You're supposed
mm,
to know somebody, you have this network and all this stuff, which I did. But honestly, I just applied on, it was either LinkedIn or on Teamworks or something. And then, yeah, they flew me out, did an interview, one of the hardest interviews I've ever done, but it was exactly what you wanted in an interview. And yeah, and then here we are. Not, when I say outside of my comfort level, being in one professional sports, already outside of that, and then being
mm.
working with professional MMA athletes, which I had never watched a UFC fight before. Everybody hates when I tell them that too, right? I knew nothing
Yeah.
about the sport really. I had treated some jujitsu athletes, some pro wrestlers, but nothing to this extent. And people always ask, like, oh, like, how'd it feel going into a sport you've never worked with before? And I'm like, honestly, it's all the same. One, I everybody's the same to me. I don't know
Hmm.
who's famous. I don't know who is who. So I treat everybody the same, which I think was a huge perk and a huge benefit for me. But ultimately, the fundamentals, right? Just like with strength and conditioning or performance or anything, the fundamentals are all the same, right?
Yeah.
Like I need to be able to treat the 90-year-old granny who's had 20 years of low back pain, right? Like, regardless of who I'm going to deal with next. Now, as we start getting into more sport specific things, sure, but I always utilize my athletes, right? Like, they know their sport the best, they know their bodies the
Hmm.
best. So I always incorporate them in creating drills, creating treatment plans and things like that. So like really the transition wasn't hard because my background set me up to be as successful as possible in this even higher level interdisciplinary, you know, pretty much like ecosystem that we have here.
Yeah.
So sorry, that was
No, no, no,
long-winded,
no.
but
So there's a lot to unpack there, and I kind of want to
yeah.
get to some of the like basic, really early start, and it's something that I truly, truly believe in. It's experience over a piece of paper, and like obviously going through all the Division One programs, all the different high school teams. Now you're at it is the best MMA sort of organization in the world. Like, how did one experience sort of follow each other, and how did that prepare you to be where you are just now?
Yeah, so I think from a like a sports lens, because I get this question a lot because there's a lot of different types of residencies out there.
Hmm.
There's some that are very high school based, like I went to, and there's some that are very collegiate, like high level residencies as well. But for me, starting at that high school level was the best thing I could have done because those athletic trainers, those coaches, they need help. They need all the help they can get. They are spread so thin. So it gave me true hands-on experience. So like for me, the high school I covered, the JV team was my team. I ran onto the field. I talked to coaches. I called parents. I did everything from start to finish with them.
Mm,
But if I'm trying to learn and gain experience at a really high level right off the bat, like in college, they have athletic trainers for that. They don't need me to do any of that. That's not really my role or place. So I think like from the start, getting experience and really understanding what those athletic trainers are doing, what those strength and conditioning coaches are doing on the ground level, kind of like maybe at that like high school whatever could be anything,
mhm,
um where you can really get your hands dirty. Like that's the key, right? Is like you don't know what you're going to do when you see a broken leg until it happens, right? But if you're in a position where you're kind of stuck in a corner or siloed off, like you're never going to be able to actually do that. Or things like growing up being an athlete and working with strength and conditioning coaches, and I always remember talking with them like, how did you program this? Why are we going this way? Versus whatever, like, why are we doing this specific lift in this specific way? And that's the kind of hands-on experience that you want. And I think that's why a lot of like, you know, people in sports grew up playing sports,
yeah,
right? Like it gives you that experience and that
mhm,
exposure. So for me, like that's kind of where it started was like just getting your hands dirty. And even in PT school, when it was COVID and I couldn't get sports experience, right? I'm trying to build up a resume to apply for residency and there's nothing. I just reached out to an athletic trainer at on campus and I just would go to their labs. Like I would just go to their classes and getting that kind of experience, right? So that's kind of where it started. And ultimately, my goal was always to like just build confidence as a clinician. Like, I honestly just wanted to be able to talk in a way that didn't sound dumb or rambling, you know, to be clear and concise. Right. And like when you first get out there, you're like, first off, who's letting me be a physical therapist? This is insane. Um, but then you just want to come off as confident, and that helps you get buy-in right off the bat. And that can be, you know, for any profession that we're working with, especially now at this higher level. With, I mean, I'm working with adults, even though half the time they act like kids, right? But being able to walk into a room and be like, all right, we're doing this, this, and this. This is the plan moving forward, and this is why. I've gotten a lot of athletes who've asked me if I'm from the East Coast because I come off really assertive, and I find that a
Mm,
compliment since I have family in New York and New Jersey. So, um, yeah, so that's kind of where I started, and why I found that like so pivotal in getting me to where I am now. Because I mean, I do all that acute injury stuff now. We cover fights on the sports med side. So the way that our clinic is set up is at the PI in Vegas, we treat one on one every hour. Um, Usually just like a general 8 to 5 if it's not a fight week. And then we rotate through who covers the fights. So I'll
hmm.
travel domestically and globally, which is really awesome. And so we'll kind of treat throughout the week if we're traveling, and then we will cover the fight that Saturday night, including the fights
Yeah,
that are here in Vegas. And so
yeah,
we provide that medical coverage in the back where we are splinting, we are doing wound care, we're fitting crutches, boots, a lot of education on how do you take care of this injury, what needs to happen next, and then kind of collaborating with our physicians to make sure that they have a good continuation of care afterward.
yeah. You were just at a Miami card, weren't you? Yeah,
Yes.
that was some card.
Yes, we were
Yeah,
busy, I'll tell you that.
especially towards that later fight cards where the main events were obviously quite stacked with injuries as well.
Yes, it's always interesting. I see something new every time. And that, I mean, honestly, being here, I see something new every day that keeps you on your toes, which is the best part, right? I ultimately, my long-term goal was I don't want to deal with insurance, and I
Hmm.
want to go somewhere where I can work in t-shirts and sweats, and I can't be in the same place the whole day.
Yeah,
Those are my three kind of requirements long term, and so we've checked all those boxes here.
my dad hates it when I say this. So like I'm the exact same as you. As long as I'm in sweats, shorts, t-shirt, or a hoodie, like I am golden. Like I am
Right,
perfect. But my dad's a little bit more old school Portuguese, where he's always like dressed to the nines. Like he's always got like a vest or a suit on. And I'm just like, look, I picked the job that I'm in just so I could wear shorts and hoodies.
right.
He hates it, but like at the same time, it's like it's comfortable. Like who doesn't love being comfortable at work?
Well, you're moving around and you're doing all this stuff. We're on our feet all the time. Like, I don't want to have to squat down in khakis, you know?
Mm,
Like, it's just so silly. So,
100%. Back to an earlier point that you had is like I once had this lecturer say to me, like we're obviously in this course because at some point along our ways we've had a really good experience with sport or a coach or a trainer or a teacher that has led us to have such a good experience that we're here. So it's that thing of always wanting to be that good experience for someone else as well. Is that
mhm.
something that you've sort of found along your ways?
Absolutely. I mean, I have a laundry list of mentors and people who have really influenced and affected my life, personally and professionally. And I think like that is something I always try and do is to give back. So I
Mm,
will any student, any person that reaches out to me on LinkedIn or DMs me on Instagram, I always give them my phone number and always work to set up a phone call with them, like no matter
I can
what.
vouch for that.
Yeah, yeah, right. Um, because like those little conversations like mattered so
Yeah.
much to me, and if I could just help and say one little thing, like I just recently talked with she's a kinesiology student in Canada, and she's doing a dissertation, like she's doing a thesis or a dissertation on being like working as a woman in
Mm,
sports, which is a big passion and advocacy thing of mine. And just to just give her some things and her feedback of like, I had no idea where this conversation was going to go, but you have like impacted me so much, and I just appreciate that. Just to get that back like means so
hmm.
much, because I think of all the people that did that for me,
Yeah.
because I definitely wouldn't be where I am without those individuals for sure.
I've got a couple of articles that you might be interested in reading. So, at the university I was at, one of the lecturers there, she's sociology, but she does a lot of kind of S&C related to women and how women are perceived in the industry. So she
Mm-hmm.
breaks down like the whole male orientated industry and how that impacts female coaches and It's a really interesting. I'll link it down below as well because it's a good read.
Yeah, absolutely. I mean, it's such a big topic of conversation now. I mean, and it always should have been, right? But now we're really getting some good limelight. But I think like people ask me, "Oh, have you dealt with, you know, d
X, Y, and Z.
whatever
Yeah.
X, Y, and Z as you gone through this?" And I'm like, "Yeah, of course. Like I've been looked over for plenty of jobs because of that. I've had lots of comments. I'm also really short and small, so the
Mm,
amount of comments that I get because of that too um, is pretty funny. Most of the time, athletes are like, you don't look or feel that small when your elbow is in
impressive.
my butt. I'm
Yeah.
like, yeah, I know. Um, but I think it's all moving in the right direction.
Hmm.
Um, for sure. There's always going to be something.
I've,
But
I've
it is, yeah, good.
sorry, I've butchered this story so many times on this podcast, and like, so my research, my bachelor's was on female athletes' perception of effective strength and conditioning coaches. So the way I got into that was one of my lecturers, funnily enough, sociology. I hate sociology with a deep burning passion. But she essentially was like giving us a lecture, and she was saying that no research gets done on women. Like me being stupid and naive, I was like bullshit, and like I said this out in class. And fair play to her. She didn't react. She didn't sort of backlash at me. She was just maybe she essentially was like, okay, this is a challenge I've got for you. Then go do some research. Come back to me
Mm,
next week, provide me the articles that you find. I was like, bet, let's go. Came back the next week and I was like, look, you're right. There's no research on women. Like, why is that? She's like, well, in research, women are seen as half a man or a little man. That's one. Two, unpredictable. A lot of variables that can be messed up with menstrual cycles, and anything that hormonally happens with women gets sort of pushed to the side. And I was like, that's kind of fucked up. Like why is that a thing that
right?
happens? She was like, it's just because it's too hard, so no one wants to do it. I was like, it's not really how research works in my naive
Right.
mind. And then I asked her like, what can be done about it? And she was like, well, you've got your dissertation coming up, right? I was like, yeah. And she's like, well, it's like, got you. So like from then on, like now I'm sort of applying for my masters and writing my research proposals on like the impact that the menstrual cycle has on psychological and physiological output on training and different parameters to see how effective it is. Like traditional physiology papers will say that there's no difference, but then when you look at the methods, I'm just like, is that
Yeah,
really a measurable test?
absolutely. I think that, well, it's interesting because my big passion is concussion research, rehab, all that stuff. One of like the big kind of myths out there is that concussion rates are higher in females, which they are, but like one of the big some of the evidence is more of the reason the rates are higher is because the exposure for females is so much lower. So they're exposed
Mm,
to like contact sports or strength and conditioning or perform any of that so much later on
mm,
that they're probably their tolerance to those impacts, their ability, their strength, their coaching of how to tackle or whatever sport they're doing is so late and so delayed compared to their male counterparts. So it's not so much that, oh, just because you're female, you're at a higher
mm,
risk. There's so many other pieces that play into that. And so just to kind of throw female athletes into these like bags and columns or whatever is it's honestly just lazy. And I think the excuse of the menstrual cycle and all that being super complicated, like it doesn't have to be like
no,
right. And so and you even see it like here, like we have female athletes, like there's a lot of us, but there's minimal. You just need
yeah,
people to care and to invest time in that.
100%.
And I think there's a huge push now that female sports in general are the viewership,
Mm-hmm.
the money, right? Like is much greater. Um, so yeah, I mean it's exciting. It's a really exciting time to see it come together. I'm excited to see how
100%.
your dissertation looks.
So am I. I really can't wait to start it. I will always say this. I've never said this in the podcast, but I have friends who played women's soccer. I really like a decent level. Like they go into the national teams and like they did well for themselves. She invited me to watch one of her games. Now, women are physical. Like I don't care what you say. Like if you get cornered, you are fucking physical and I'm
Hmm.
here for it. So she was running with the ball and she gets like side tackled. She does a flip. Like she flips, lands on her back, gets up straight away without missing a beat, and just continues. I'm just like, fuck. If that
Hmm.
was a man in soccer, he'd be down fucking whinging. I'm like,
Right?
I got so much respect for football now. Well, soccer, women's soccer, because it's just like they just get up and just go.
Oh yeah, love it.
I'm also interested with concussions in females, specifically in combat sports. Does that what's the correlation between that and obviously because there's not as many female athletes in combat sports, they essentially have to resort to sparring or training with men. How does that change that concussion rate?
Oh gosh, what a great question. We don't have an answer. A concussion in general, in one research in combat sports is really minimal. The epidemiological data out there is really sparse. Um, and we were recently just looking at this, and it's just not a whole lot. And that's something that the UFC is really pushing is to build out some really high quality epidemiological data.
Mm,
Now, the hard part is tracking, right? So like the way that our system is set up is athletes can use the PI. Any UFC contracted athlete can use the PI resources as much as they want. It's all for free for them. So they can use this as much as they want, or they can use this as little as they want, right? It's not like a team sport where
mm,
there's a little more accountability and eyes on athletes because everything is really kind of scheduled out. Here, it's a free for all. So the biggest issue is I can't even give you an answer because we don't have a good
mm,
idea of how many concussions are actually occurring. And I like when the moment I got here, that was one of the things I started to try and tease out. So every athlete I work with now, almost always, I'm just like, hey, what's your thoughts on concussion? Like, why, like, don't
mm,
people talk about it or say anything? They're afraid of it, you know? And it comes down to ego. It comes down to just like I can't admit that I got knocked like that by
mm,
somebody, and I won't ever admit it. I will never admit it to anybody. So that's why I won't come and disclose. So that's really common. So that's like a cultural thing. So it literally starts with just education. So I can't tell you like we've come out with some incidence data like a 15% like rate of concussion in our athletes in training and in like in actual fights, but it's not true. Like it's just not truly indicative of what's going on because we just don't know because
yeah.
athletes won't come to us, right? Like if we can't get the data to begin with, then like there's not then everything that we do treatment concussion wise like doesn't really matter if we're not getting athletes in the door to come see us for that. Which is challenging because I came from. So the one main reason I went to Duke for residency was they have a really incredible concussion program
Mm,
out there. And so from the start, I was treating athletes for concussion because we had a funnel system to bring them in. And most of them were coming from team sports where you're having an athletic trainer on the sideline watching practices and can catch those things. Versus here, like we're treating all day. I can't watch a sparring session every time, you know? So one, it's we got to get athletes in the door. We got to get them educated enough to feel comfortable disclosing things when they happen. And I think too, the other issue, which I had an across the board, is just understanding what a concussion is
mm,
and what it feels like. And I don't know if you've had concussions in the past. I've had several concussions in the past, which is kind of why, just like with anything, right? You had an injury, you got PT,
mm,
that's why I'm a PT. This is why I'm really passionate about concussion. And what I hear a lot is athletes saying, I didn't have a headache, so it wasn't a concussion.
yep.
And so, right, like it's hard to change that narrative unless you're constantly educating those athletes, right? Like I'm sure in teams you sit down and you go through it at the start of the season, but like nobody's actually paying attention and being aware or gives a shit. Like it doesn't really matter. But starting with like that doesn't necessarily have to be the case. You don't
Yeah.
have to lose consciousness to have a concussion. Actually, athletes who lose consciousness tend to recover a little more quickly than those who don't.
Okay.
Yeah, so that's kind of what the individuals who do have a headache or do have dizziness, they tend to have longer, prolonged
Mm-hmm.
symptoms. But you don't have to have a headache to have a
Yeah.
concussion, right? And I think what's super unique and challenging about MMA and even now it just gets me thinking in general about concussions is if I'm pulling a guy off the field, like football fields, and evaluating them and I'm testing their memory, I'm testing their vestibular ocular motor function and all this stuff, but it's the fourth quarter and they've played almost every snap. You know, like in high school, right? They're playing both sides. Like if they're fatigued out, they're dehydrated, whatever, and now I'm trying to do a full
Yeah.
neurocognitive assessment on them. Is that really
The
accurate?
best thing. Yeah. Protocol. Yeah. Yeah.
Right. And so, especially like on a sideline like that, I got to make a quick decision, right? Like, okay, I can give him a couple seconds to like calm down, give him a breather. Then I got to make a decision, right? Coach has to know right now.
Yeah.
Is that truly accurate? Right. Versus maybe in other sports, like you have more time and you can get them in a quiet environment. You know, they're taking a second, they've ate, they're drank, all that good stuff. But like for these guys, if they just come out of a sparring session or they just finished a fight and they just got whacked in the head multiple times, right? If they just lost, right, the emotional high, the adrenaline dump they get after,
Mm-hmm.
am I truly going to get an accurate concussion assessment afterward?
Or honest as
I
well.
don't, right? Yeah. I mean, okay, my head hurts right here. Well, I just got hit. I got punched in the face right here and I have a laceration. Like, is that really a headache? I don't
Mm-hmm.
know. Are you fatigued because you got a really crappy weight cut and now we just fought? Maybe. Um, so I think just kind of getting a broader perspective of everything is not black and white. I
Mm-hmm.
think in some settings it can be really easy. Like that was the beauty of being in that concussion clinic. Like we worked really closely with other physicians, athletic trainers to kind of funnel that in so that I was treating athletes like we knew we're dealing with prolonged concussion symptoms. Versus in this setting, it's like, well, I had a tough wrestling. Like I got kind of slammed on the mat during practice and I feel crappy. It's like, well, I always kind of feel crappy and I'm in the middle of cutting. I
Mm-hmm.
haven't eaten that much. I'm cranky. I'm emotional. I'm getting stressed about the fight. Like it's really, really hard to tease out those things. Um, so I'm just learning to kind of take a step back versus like, oh yeah, when I first got here, I was like, yep, that person has a concussion. Yep, that person. And they're like, okay, the next day they actually are fine. They just
Yeah.
kind of had a rough
Oprah
session
Winfrey.
or they, yeah. Yeah, so it's definitely like very much humbled my concussion side of
Mm.
things and maybe really rethink how to kind of go about this. And you know, I've been here for 7 months now, so we're still coming up with a plan of how to get that's like the long-term goal. Like I do want us
Yeah.
to become like a concussion center for people to
Mm.
come to, but like
I do
there's
think
a
that's
lot of work to get through.
that's the best sort of industry because you'll see so many athletes getting either knocked, rocked, or some type of impact or blow to the head that you're bound to have more than your usual sport.
Hmm.
On the back of that, I've got two questions. How hard is it? Because obviously, in the UFC or mixed martial arts, you essentially only get paid for fighting. Oh, like there's sponsorships, there is that whole system. But with that, have you noticed an unwillingness to come forward with any type of injuries or concussions in fear that they get pulled from that card or that event that they're supposed to be fighting in?
Absolutely. I mean, and that happens with any kind of injury.
Mm-hmm.
But what the, the sports medicine side on our end is separate from UFC medical.
Ah, okay.
So yes, so all of our notes, all of our injury, like a lot of our injury data, all of our notes from treatment sessions and everything is confidential. So UFC
Right.
medical doesn't see that. So oftentimes, like we are treating athletes with injuries 2 weeks before a fight, but it's like, oh, this is very manageable. We're just gonna clean some of this up. We're going to manage the pain, but you're still fighting. Okay, maybe we're modifying. Like we've been dealing with a lot of rib injuries. So like, okay, you can still pretty much do everything you need to do in training. We're just going to pad you up. Let's try and avoid getting
Mm,
hit there for the next 2 weeks up until your fight. And then you got to go. I mean, that is a huge, huge thing that we keep in mind where, I mean, these athletes, like this fight is going to dictate if they can pay rent, support their
yeah,
family. You know, unless you're in the upper echelon of fighters, right, where it's not a big deal either way. But these athletes, or let's say they have a 2 fight contract and they just got in. This second fight is a big deal because this is a make or break. They could just
yeah,
get cut right after that. So we luckily we get a little more wiggle room on our end to try and manage a lot of things um, without like fearing that they can get cut or pulled from medical. Now, if
yeah.
there's like big issues coming up where it's like, I mean, we had an athlete come in recently who had a severe cervical radiculopathy where they couldn't even sit up straight. They literally were just leaned over. They were losing grip in their hand. They couldn't even hold a toothbrush, right? And they're 3 weeks out from a fight. Like now he's okay, right?
Yeah,
Like we're gonna be real with you. Like yes, there are inherent dangers and risk to being an MMA fighter and fighting, but there's a difference between risking your just daily life and your livelihood and risk it. You know, if you can fight, if you can do what you need to do in a fight, we're going to get you there as best as we can. But if you
yeah,
can't even hold a toothbrush, how are you supposed to punch
yeah.
somebody, hold on, protect yourself? If you can't protect yourself, then you know that's not safe for
That's a
you
bad
or your
fight.
opponent
Yeah.
either, right? Yeah. So it's an interesting balance and it's an interesting setup and it's been very unique here versus like in that collegiate setting. There's other things you have to keep in mind where it's like, oh well, if it's their last season, it's the last game of the year and they're a senior. Okay, are we gonna just take this up and do what we have to do to get you out there to do it versus like, all right, you're a freshman. Why would we risk this?
Yeah.
You're probably going to get recruited to the pros. Like, what are we doing here?
Mm.
Similar, but just like a little different stakes for sure.
Can you take us through some of the current protocols and sort of any tests or battery that you kind of have to identify these and how that process looks?
Yeah. So a lot of, so if we have an athlete, let's say we have an athlete come in complaining of headache, they feel off, all this stuff. So upon initial evaluation, really it's heavy subjective, super
Mm-hmm.
heavy subjective of what exactly happened. How did you feel the moment it happened? What are your symptoms now? Have you had a concussion before? Um, what are your aggravating factors? What are your easing factors? Like I take an extensive amount of time on my subjective because honestly, that gives me almost more information than what I'm going to get from anything else. Because my immediate treatment is going to be based on what they tell me. Um, so like college athlete, like let's take like we had a college basketball player coming in saying like I can't focus on the ball. I'm getting a headache.
Mm.
She had rammed into another athlete. She had like they had collided. She doesn't know if she hit her head on the ground or hit her head on the other player. But she was able to keep playing because at the time she was like, yeah, my head hurts because that's where I kind of got hit. I felt a little dizzy for a second, but then I got up and I was like, fine, like, okay. She kept playing, right? Which we know if you have a concussion and you return back to play immediately, your risk of having prolonged symptoms, which for adults is greater than 7 to 10 days, having symptoms lasting longer than
Mm.
that. Or for kids, it's greater than 14, greater than 2 months. So kids and adolescents are a little different. But
Yeah.
ultimately, for a concussion, your symptoms should resolve within 7 to 10 days. And that's how most go. Most of them do go. Um, Now I can go down a whole nother rabbit hole about this, which we can come back to later about lower extremity injury and concussion and that return to play. But for the
I'll
sake
write
of
that down.
this, yeah, yeah. So for the sake of this, right? So like she's coming to me, she's saying she can't focus on the ball. She is having a hard time reading in class. Like that aggravates her symptoms so much. And she has a heart, like when she looks at the projector, it makes her symptoms worse,
Mm.
right? So she's had a concussion in the past, but um, her easing symptoms are closing her eyes. If she lays down, and closes her eyes, she feels a lot better. Or if she just stops reading, she can feel better. So for me, like that already tells me a lot, right? Like we probably have some vestibular ocular thing going on, right? If reading, focusing, things like that. But really, ultimately, what I'm going to tell her is, all right, I want you to read, but I only want you to read to the point where you get a little symptomatic and then
Mm.
take a break, right? If you start getting symptomatic in your daily life, right, you need to step out and take a break. Let's write a note to your professor, whatever that is. So the way I explain it to athletes or anybody is when you wake up, because most people feel best in the morning, right when they wake up. Some people don't, which this wouldn't work, but you check in with yourself when you feel the best. And you say, all right, on a scale of 0 to 10, where am I at? They say, okay, when I wake up, I'm at a 0. I feel absolutely fine. I'm like, great. Now go through your day. As you go through your day, if you ever get up to a 2 or a 3 with anything that you're doing, take a break. What makes you feel good? Okay, closing your
Mm.
eyes, putting on some meditation music, that makes you feel better. Great. Let's get you back down to a 0 or a 1. Then you keep going. So it's so much activity modification to have them get
Yeah.
through that day. Yeah.
So you're essentially saying that you go through like an RPE, and then you essentially
Mhm.
do like reps of getting back to that zone, relax, rest, and then go back again. And then again,
Mhm.
I'm guessing that there'll be like a sort of progressive overload to this.
Yeah, so that's exactly what it is. And that's exactly how I explain it to my athletes because they understand muscles a lot better than the
Mm.
brain. It's just like lifting weights, right? Like you have to push into fatigue, get a little microdam, put whatever, right, to signal to your brain that we need to build up here. It's the same thing for your brain. In order for you to get better with whatever exercises or activities we're doing, we have to push into symptoms a little bit
Mm.
to know like okay, that's the max, now we can step back. The problem is athletes don't listen and they will overdo everything and they will push themselves to a 10 out of 10, feel like shit, and then
Mm.
they're out of commission for 2 days because then they wake up the next day and instead of feeling like a 0 out of 10 they're feeling like an 8 out of 10 and then they can't even start their day going. So honestly, like especially when I talk to PT students, because I've given a couple of guest lectures on how concussion evaluation and management, is like the best thing you can do is just talk to them and give
Mm.
them that kind of guidance. And that comes into like when I start transitioning them into the weight room, which can happen quite early. That happens quite early compared to getting back to academics because academics is so hard cognitively
Mm.
that athletes will return to more sport like things like running and getting in the weight room before the academics, and academics don't like that. they
Yeah,
they can't comprehend like why are they running but
but
they
not
can't go to
coming in.
class right now, right? And like to that, like the other thing that I always have athletes start doing the first day I meet them is start walking, start some type of
Mm.
aerobic activity, right? We know that speeds recovery, aerobic activity. Now I will use the Buffalo treadmill or the Buffalo bike test to assess that. I usually don't get that done on the first evaluation.
Can you
um,
explain what that is?
yeah, so the Buffalo treadmill test, which was developed by Dr. John Letty, is a test to assess for exercise tolerance.
Mm.
So, a lot of the times post concussion, people do not tolerate exercise, usually due to a disruption to the autonomic system. And so, it is a progressive exercise test where on the treadmill, you're walking at one speed and you're progressively increasing your incline, or on the bike, you're increasing watts and resistance. But you are monitoring heart rate, you're monitoring symptoms, and you're monitoring their RPE throughout this progressive stage. So for the treadmill, every minute you're changing the incline and you're checking in. How are you feeling? So you use that visual analog scale, 0 to 10. And then there's criteria to stop the test. So usually, if they get like 3 points increase on their VAS, so they go from no headache to 3 out of 10 headache, or let's say they go from a 1 on a headache, but now they're dizzy and they feel fatigued, that would be 3 points. So there, and you can easily, I can always send you the link, but you could Google Buffalo treadmill test, and there's a beautiful like instruction, everything on it, reasons to stop the test, etc.
Mm-hmm.
But usually, what we're looking for is they have a significant increase in symptoms, so they don't tolerate exercise because it's making them feel worse. Their heart rate takes a long time to recover afterward. That I've seen quite a lot. So your autonomic system is for some reason not regulating. And you can do this as soon as 2 days after their initial injury. So,
Mm,
like, they shouldn't be deconditioned like that.
yep.
Same thing with their RPE. If it's really like it's gone sky high and they're only on level 5 out of 20, like that's not
Mm,
tolerating exercise. And then actually what we've seen quite often is a as they're going right like with an increase in intensity in exercise you should have an increase in heart rate to follow that to maintain that, right? We know that there's a plateau based on stroke volume and your conditioning and the strength of your heart and all that, but what I've seen quite often is halfway through their test they get a drop in heart rate, like a significant drop in heart rate.
all
They go
right.
from like 120, 130 to 80, and they stay there for 2 levels or so. And then it comes back up and they're
Wow.
fine. So during that drops, oftentimes athletes will say they either feel worse, which kind of makes
Mm.
sense, right? Your heart's not keeping up, or they feel better. Their symptoms will actually decrease.
So will
And
that
then their
be
heart
like
rate.
going like to a normal state? Is that why
What do you?
they
Oh,
perhaps feel better?
no, I could not tell you. I could not tell you why they feel better when they're coming back down because it's just a dysregulation of that
Mm-hmm.
autonomic system. Like your body is not responding to stress in an appropriate way. And so based on that test, you'll take 80% of their like max symptomatic heart rate. So let's say they hit like their 4 out of 10 headache at level whatever and their heart rate's at like 160, you take 80% of that and then that's what they train at.
Mm.
So, yeah. So I mean, and there's been a lot of studies to show that that early aerobic training is super, super beneficial. And I always encourage clinicians that even if an athlete is symptomatic, as long as they're not severely symptomatic, right? Like they can't even tolerate like just being around people, right? Like
Mm.
that's different. But even if they're slightly symptomatic, doing this test is so valuable because training at that 80% symptomatic heart rate speeds up recovery so well.
Yeah. Would you
Um,
compare that to like early mobilization for any type of joint or muscular pain?
yeah, I mean, that would be a great comparison, right? Like different mechanisms for sure. Um, Ideally, right, we're addressing the symptomatic heart rate. We're trying to re-regulate cerebral blood flow. There's a
Mm.
lot of conflicting data on, oh, there's an increase in blood flow. Oh, actually, there's a decrease. We kind of see both, but it's a way to get that cerebral blood flow kind of back, those barrier reflexes to be responding appropriately again. One, it gets athletes just excited to be doing
Mm-hmm.
something, which plays a huge factor, right? We know that athletes who have a history of depression or anxiety also have a risk of prolonged symptoms, right? So if we can try and mitigate that with getting them doing something is huge as well and definitely speeds up recovery. So I'm huge proponent, even because when I say I don't have time usually the first day to do that test, I'll
Mm-hmm.
just say go on a walk. Go walk for 5 minutes. As long as the sun doesn't bother you, right? But I always remind people, okay, only walk for 5 minutes. That means like 2.5 minutes back out, and then you have to come back because athletes will walk for
Mm-hmm.
20 minutes and feel
And then
great,
come
and then
back.
they hit 20 minutes and then they're stuck. And literally, I've had athletes call me to come pick them up because they're stuck somewhere because they feel really bad and
Mm-hmm.
they can't walk all the way back, right? So it's those little things like that early education and management is so vital. And you don't have to be a super specialized concussion therapist or person to like give some of that helpful like
Yeah.
guidance out initially.
Yeah. What's your take on the whole sleeping while you're concussed topic?
Yeah. Oh, like getting in a dark room and
No,
like
no.
sleeping or
So
not sleeping.
straight after you get concussed, falling
Mm.
asleep.
Oh, yeah. I mean, I'm always about you guys can sleep. Now, if I'm worried about like a brain bleed or something, which is fairly unlikely, right? You're probably going to get some other symptoms
Mm-hmm.
along with that before they pass out. But I sleep is huge. I mean, your brain needs to recover, and
Cover.
sleep is
Yep.
an optimal time to do that, right? Like if we're saying that like cognitive work is going to prolong
Mm-hmm.
your concussion if you're pushing into symptoms, it would make sense to sleep. right?
Yeah.
Like that. Now, what I do encourage, and I'm okay if athletes take naps, because a
Hmm.
lot of the times they'll get this extreme fatigue and they just can't make it through the day without taking naps. I'm like, that's fine as long as you're limiting them to like 20, 30 minutes, because if you do those 2, 3 hours, it's going to fuck up your sleep that night and you're not going to be able to get good sleep. So sleep hygiene in that
Hmm.
early phase is so, so important. Yeah, so always tell them to
Yeah,
sleep. You're
you're going
fine.
to love this story. So I played rugby, um, and it was at a time where concussions weren't really a thing, we'll say. So the way my rugby season worked is I would play for the high school, and then on the Sunday I'd play for the local team. So Saturday game, Sunday game, I would get concussed on the Saturday, play on, and then play the Sunday, and then school the whole week, play again, concussed at some point, and then just keep going.
Mhm.
Um, there was once where a guy stuck his arm out and just like clotheslined me. I
Oh
went
no.
home. I got taken home by a teacher, saying, "Hey, your kid's concussed. Look after him. Goodbye." um, and then my mum and sister were so vigilant of me not falling asleep in case I died. Suppose that I was just like, dude, I'm just tired. I'm fine. Um, but that's what kind of brought on that conversation because th- there's it, it was a big myth for a while where if you fell asleep after getting concussed, like that's a big no no. So I kind of want you to debunk that a little bit.
Oh yeah. No, huge no no. I mean, it originally it was for the few cases where people would get delayed like
Mm,
brain bleeds. And so you can only mitigate that so much, but again, like I said, they will give you other signs before they just pass out, right? And
mm,
usually you're going to get like numbness and tingling down the both arms, both legs. They're going to get groggy and agitated. They're going to have slurred speech. They're going to be really off. They could get really irritable. Now, irritability is also a symptom of concussion, but they're just going to be far more off. Like those are the red flag. Like they get really blurry vision. They can't see very well all of a sudden. Like, yes, blurry vision is could be a symptom of concussion, but it's to like an extreme extent and comes on kind of all of a sudden. So those are the red flags that we look for.
mm-hmm,
Now, if before they go to bed, you check in with them and like, yeah, like I feel off, I feel foggy, like people just don't feel right after a concussion and it's really hard to verbalize what that is, right? But if you have an appropriate medical provider assess them and assess those things, you'll catch any big red flags, right? Like a lot of the times I'll get parents will ask me, should we go get an MRI? Should we go get a CT? Like, do we need to get this like right now? And I'm like, no, concussion is a structural injury, or sorry, concussion is a functional injury, not a structural injury. So all of your imaging is going to be negative. Now,
mm,
if they're getting complete numbness in their arm and all of a sudden they can't walk, right? Like, no, like that's obviously much different. But the likelihood of that is so low. And we, at our high school, we would give out handouts, pamphlets and QR codes that they would scan that would
mm,
have all of the red flag symptoms on there of like these are the things you should look out for. If these things happen, then yes, you should go to the emergency room. But being fatigued and wanting to sleep is not one of them.
yeah.
It's just not. They will wake up vomiting, and that's a red flag. They're usually not just pass, like, if they're sitting at dinner and eating with you that same night and they pass out, that's different, right? That's not sleep.
Mm,
That's them passing out, and we need to go get them checked on. Um, so we really try and educate our athletes and our patients of those things and try not to scare them because ultimately we do get those questions about imaging and it's like, hey, I don't get into the nitty gritty of the physiology, but you know, our imaging, we have no blood tests, right? We know the saliva tests are slowly
mm,
kind of maybe coming around, but we're not going to see anything on imaging. The only time I order imaging is usually in collaboration with a physician, and most of the time it's an athlete who's had symptoms for a really long time, and they just need peace of mind that there's not something else going on in
yeah.
there. So that absolutely debunk the sleeping.
Yeah.
Sleeping is okay.
To a point that you were sort of briefly mentioned before, the lower extremities and concussions.
Yes. So this is like a big passion project of mine. A group of us actually just presented on this at our combined sections meeting, which is our big physical therapy, like our national physical therapy conference back in February. And so really there's so much injury data out there that shows this increased risk of concussion after a lower extremity injury and the increased risk of lower extremity injury after concussion. Like there's so much
Hmm.
of this data of higher ACL tears if you've had a concussion in the past and vice versa. And so the question is like, okay, correlation, causation, like what are we truly looking at? And ultimately, what we find are these long term neurocognitive and neuromuscular control deficits after concussion that last up to a year following injury, right? And we know we're clearing athletes, right? 7 days, that normal stage
Hmm.
return to play, but they're actually seeing continued deficits in dual task ability, changes in gait when they're doing dual tasks. So it's like when you do a tandem walk, and when you add some other cognitive load or motor task to that, there are changes in their gait, like
Hmm.
increased sway, poor balance, poor postural control, changes in velocity, like gait velocity, following concussion that are lasting far past when they become symptom free. And so there's a lot of different theories behind like why this is happening. Um, and we can get, there's like a lot of nitty gritty stuff into that. But
Hmm.
ultimately, the thing here is that we are letting athletes return to play without truly assessing if they've returned to that appropriate neurocognitive level and skill that they need. Because if you are not able to multitask, if you are not able to maintain attention on what you're doing, getting rid of unwanted information, be able to think and plan and see the athlete in front of you, who is on your team, who is not, and then see in your
Hmm.
periphery a ball's right. Like when you think through all the things that an athlete has to do, all of that is neurocognitive skill, attentional control, reaction time, dual tasking, working memory. And then you have them do a motor task at the same time.
Hmm.
No wonder these athletes are having a risk of injury
Yeah.
and increased injury risk, right?
Have you ever looked into Soma technology?
Sorry, which technology?
Soma?
So we um there's been a big there's a lot of okay, why does this look
Oh,
familiar?
sorry.
Yeah, yeah. I don't think I've seen this before.
So I've kind of been looking into it from a cognitive standpoint, and it's kind of mentioning what you are, where it's like that cognitive load and then physical load come in combined. And I spoke to Peter, who's a more sports S&C coach. Now, with more sports, specifically car, there's so much happening in your peripheral, and there's people talking to you in your ears. There's things happening in front of you that you kind of have to be sharp cognitively, specifically with like these 24-hour races where you're like constantly on the go. So
Hmm.
he's introduced Soma technology into his coaching because it sort of targets that. That led me to speak to the CEO of Soma, and they're trying to get some studies on concussion protocols and how they can bear it, because like the SCAT 5 or whatever it's called, like, can you remember your cat's name? Like, I think there's athletes up
So
here the
okay.
best, like they can't remember what they had for breakfast this morning, let alone
Hmm.
something from different.
Yeah. So and these are my thoughts and feelings. Well, they came out with the SCAT 6, which now adds a dual task gait assessment on there, which I love, right? It's something. But keeping in mind, like the SCAT 5 is only valid and reliable up to 72 hours after an injury. So, like, to be using that as like baseline data to then look back at later on, there's really no evidence that baseline data, even with like an impact or a C3 logic, like using baseline data doesn't truly influence clinical decision making. Because I think of like if I do an impact, right? Okay, they've hit all of these things except one. Am I going to not return them to
Mm,
play because of that one thing? And is that truly indicative of, in this context, their ability to dual task and multitask on the field? I'm not really sure. Um, the only thing that has been shown to be the most like valid and reliable baseline test thus far is symptom scores, right? It's so subjective, but it's those symptom scores, because almost nobody is at all zeros. If you've ever
mm,
looked at that, those 22 symptoms, I have probably like 10 of them on a daily, right? But that's great, because if I'm looking at an athlete post concussion and they're hitting way more than their baseline, or they look kind of just like their baseline, right?
mm,
That tells me a lot more. Then it's like, oh, now all of a sudden we're having some sleeping issues, where before you just kind of were fatigued and like had a neck pain that you're dealing with every once in a while. So there's not a whole lot of great baseline testing that we
mm,
can use, but diving into more of that neurocognitive skill stuff, we can really assess that afterward. And you don't necessarily need baseline testing for that. There are some normative values for reaction time and stuff, um, for that. So we use C3 logics, which I do really like, because there's some good, it's not just, they do simple reaction time and choice reaction time, which I really like. Um, but I'm trying to get us into something more functional. You know,
mm,
not everything needs to be functional, but there's actually, like for hop testing, there's actually a reactive kind of decision making version of that, where you use blaze pods, light fit, whatever, where athletes have to react and do their single leg hop test based on a color that pops up. And so you can track reaction time, and then you compare that, not only like their control, like do they look like
mm,
shit compared to when they don't have to react, or their distance, right? Like we've seen, some of my colleagues have done some good research on this. Like they've seen a pretty significant decrease in single leg hop distance when they add that dual task reactive component, right? And I don't necessarily need a baseline to make that determination, right? Like I'm just meeting the athlete where they're at, whether or not they've had a concussion or not. Okay, if your dual tasking ability is not good, we know that that increases
mm.
your risk for injury, whether that's concussion or lower extremity or anything. Yeah.
So, from a technical point, are you looking at like, are you comparing techniques from before and after to then analyze where if they've gotten worse or better?
Yeah, so for a test like that, I mean, ideally, right, you have a motion capture lab and you can really get knee flexion angles and moments
Mm,
arms and things like that. But I think like we should give our eye a little more credit and using just video analysis in general. So I
mm,
love videotaping. So I will video my athletes in every angle. Right. So not only am I looking at distance, like the difference between that single leg hop distance, at its face value, I'm looking at those videos. Like, do they have a stiffer knee upon landing? Are they having poor postural stability and they have a huge trunk lean dynamic knee valgus, whatever that may be, like a huge foot collapse based on the other side? Do they take more trials
mm,
from either comparing side to side or when they have to add that reactive component? And then you can also kind of get a reaction time. Maybe they have a difference side to side, or you can have like you can build out like normative data. I don't know off the top of my head if there's specific normative data for that test in particular, because it's a little newer. Um, but those are the things, because we can put numbers to everything, but like you have to clinically reason through that, because if their mechanics looked crappy on the first test without the
mm.
dual task and they look equally as bad, then like,
What does it
okay,
mean? Yeah.
great. What does it mean? It doesn't mean anything. I mean, and that we can go down the whole spiel of objective testing and
Hmm.
all that stuff and how I feel about all that. But
Yeah.
even like the data science piece of everything, it's you can get lost in the weeds for sure.
100%. And because of like you said many times now, there's the research is so varied and there's not a lot of it as well. There's like, what does it actually mean and what are the actual like protocols to follow? Is that something that you're constantly facing?
Always. I think and maybe as strength and conditioning has like moved, but I in this direction too, I'm not sure. But for physical therapy, we went from making return to play decisions with purely based on time,
Mm-hmm.
purely just based on what we thought were biological healing times when we thought people were ready. And then we have completely swung the other way to objective testing. And we kind of lost the art and the clinical reasoning and decision making that balances those, not even the timeline, just making a reasonable decision for an athlete, not purely just based on numbers. And I think about this with like a lot of like the sports science data I've seen, like all this catapult data, this fatigue data that their jumps are looking bad on the force plates today. Like we need to change their entire
Mm-hmm.
training system up and blah blah blah. But when you just go and ask the athlete, they're like, "Yeah, I just broke up with my girlfriend last night, and I didn't eat anything, and I'm just really bummed." And you're like,
Yep.
"Okay, that's more information, right?" So when I look at how do we tackle all that information, it really comes back down to reminding myself, who am I dealing with? Like, who is
Yeah.
my athlete? What are we working with? Right? Like, I have cleared athletes who still have a 22% quad strength deficit, like their peak torque quad strength deficit. They have a 22%, right? That's like, oh my God, how could we let them go? They're definitely not safe. Well, their peak torque to body weight ratio was 130% on their uninvolved side and 110% on their involved side, or like if and they functionally look good and they're confident. They have done everything that I've asked. We've slowly progressed them. It was a basketball player. We did one-on-one half court, two-on-two half court. Okay, now we progress to folk. Like if you're
Mm-hmm.
taking them through all that, you have to trust that, like, yes, the numbers help, but it's not the whole story. And
Yeah,
I
it's
think
taking that
we get,
individual approach.
yeah. And especially in a team sport where you're dealing with so many people, it
Mm-hmm.
becomes very easy to get lost in that. Um, and here, it's not a team sport; it's all individual. We're taking every athlete. We have one athlete who is probably almost 6 months post-op MCL reconstruction. Her isokinetic testing, her force frame data, everything looks amazing. Everything
Mm-hmm.
looks great. Her hop testing is garbage on both sides. So at this point, I don't have enough evidence right now, objectively, to keep her out,
Mm-hmm.
right? Like, okay, like we've worked on her landing mechanics for months now. They're not changing. They're not getting better. Like I've like changed my approach, right? It's always you first. Like, what can I
Yeah.
do better? Right? But you get to a point where it's like, all right, she's got to fight soon. She has to. She's like,
Yeah.
just like you said before, right? She's got to make money. Okay, let's slowly progress her back into what she needs. All right, let's start drilling, wrestling. Let's start hitting pat. Like you have to meet the athlete where they at. It just can't be numbers. Even though numbers are nice and clear and
Yeah.
black and white, like it's just not reality.
I read this thing where a coach was talking about like that 10% difference. Is that 90% good, but you just went for that 10%? And if so, how much does that 10% actually matter? So like a brilliant
Mm-hmm.
example is what you've just said is like everything else is perfect, but her jumps are garbage. So how important is that jump to her performance? And like, is that something that she's just fundamentally never known how to jump? Like, depending on how old she is, you're not changing that. She's jumping how
Right.
she's jumping. So like, you're 100% right. It's just like that. How important is it to fix? If it's important, fine, we have to bite the bullet and just keep going. But if she functions everything else without it, let it roll.
Right. And if I were to change something that big, and I think this is very unique to MMA, but a lot of athletes too, but like if I change that, is that going to mess up her performance, like as a fighter? Like if there's
Exactly.
a
Yeah, yeah.
huge difference in range of motion on one side, well, maybe that is what makes her really good. You have
Hmm.
like, we talk about basketball players with crazy flat feet. Oh, if we fix that, is that going to make them a better basketball player? Probably not, right? Um,
LeBron
so
James.
right? Yeah, I mean, and it just comes back to just meeting the athlete where they are. Like, is this what's the biggest bang for my buck? And is this really what I need to address? And I'm
Hmm.
always constantly questioning myself all the time. what
Yeah.
what am I doing, right? And why are we doing it? Maybe it's a good why, and as long as I have a why to what I'm doing, and I'm just
Hmm.
meeting the athlete where they're at, that's always what I say. So, it's worked okay so far. So,
Yeah. And I mean, you're at a decent level as well. So, I mean, I wouldn't say that you're doing anything wrong. I kind of wanted to ask you a question based on something that you said earlier. In terms of concussions and protocols, how important is the nutrition towards that?
huge. Huge. I think that it's always a missed piece, and luckily here, um, it's so ingrained in how we manage. And so the kind of the way that we are doing things now is we've honestly taken the C word out of things. We've taken concussion out of things and been like, hey, you had a tough bout. And
Mm,
any person with a tough bout, right? There's going to be impact to your brain, to your nervous system. This is why you should care, right? It's going to increase risk of injury. You're going to feel off. You could be emotional. Like this could impact your life in general. So we've moved kind of toward this like brain health initiative. Like, yes, it's big and vague, but it's not for us. It's for athletes. Like they need big and vague, right?
mm,
So kind of pushing towards this brain health, and a huge piece of that is all of our nutrition education. And so we actually give them an entire like brain health pack the week of fight week that includes supplementation and just guidance on like, hey, you need to have good sleep hygiene afterward. Here's some melatonin. Here's another supplement that's going to help with your gut because we know there are changes to that gut brain axis after a concussion and your ability to regulate. And people will actually get like difficulty digesting food or feeling like indigestion or other things like that um, after an injury because that is part of your autonomic system as well. So
mm,
there's a huge change in the way that your gut can function if you have had a concussion. So we have supplementation and guidance for that. So nutrition is huge, and I know it's still like a big growing piece of things. I know like magnesium, omega threes, all that good stuff. Like we include all of that in kind of this nutrition health handout that we email all of our athletes after their
mm.
fight. Um, and then there's another supplement I can't remember off the top of my head that is ideally for brain health after and like brain recovery. Um, and also like managing your carbohydrates after. Like there is a big energy discrepancy following a concussion because you have all of your axons pretty much go under this tensile force. All of your sodium potassium channels open at once, and it's like an electrical storm that happens. So there is a lot of energy and ATP that
Mm,
needs to be utilized to reset those sodium potassium ion channels. But then you also have changes in cerebral blood flow that are occurring. So that you need a lot of energy, but you're not getting that energy. Plus, you have changes in your gut that's not getting you that energy as well. So you have this huge imbalance going on. And nutrition is a huge piece. And I think that honestly, we do our nutrition, our dietitians and nutrition team do such an incredible job of implementing that for our athletes, not even just post fight,
hmm.
but even kind of like throughout a camp, especially
That makes
sparring
sense
sessions
why
and stuff.
you recommend going on for that walk then, because there's so much going on that they're having to expend that energy somehow. Obviously, we know running or any high intensity exercise is the worst thing because it'll just worsen the symptoms. So that clicks as well. That's
Mm-hmm.
pretty cool actually. Yeah. So, what kind of supplements is it that you recommend for, like, what kind of? I know that the UFC has like very strict guidelines on supplementations and anything that goes into the athletes' bodies.
Mm-hmm.
What is it that you recommend for like melatonin, magnesium? Like,
Yeah.
what do you recommend?
Let me pull up our handout. Mm, Let me find it really quick because it gives
Yeah,
us
you
kind of everything that we need. The beauty of having an interdisciplinary team, there's a bunch of stuff that I don't always have to remember off the top of my
could.
head because they do it for me.
That's something that
Okay.
Becky touched on, was that like how well connected you are with each other and how good the communication is.
Yeah, I mean, and that's a huge part. And I think honestly, a lot of that, when people ask me like, "Oh, how did you get this job? What did you do to get you to where you are now? What kind of experiences do I need?" and resume building crap,
Mm-hmm.
you know. And a lot of it I come back to like, yes, everything that I did led me up to like getting selected for an interview, but it ultimately comes down to personality. Am I going
Yeah.
to fit in with the people and that system? Or am I going to come in and like wreak havoc because I just don't fit in with the culture or the people? And it's all about fit. And you can tell when one person is off, the whole thing falls
Mm,
apart. And so for me, like, I like everybody that I work with. Like, that's huge. Like, I want to come into work, right? And there are studies that have come out that said the reason people stay at their job, even if they don't necessarily like their job, is because they like their boss and the people that they work with. And
yeah.
that's what it is about. You know, anyway, so on that, so like we recommend, here, I'm probably can. So we recommend omega 3s.
Mm-hmm.
Afterward, we recommend about 300 milligrams of omega 3s, definitely early on, and then tapering that down as you kind of in the later stages, just like whatever like daily intake that you normally would. Um, and then really monitoring the actual food that you're intaking. So having a good balance between protein, but getting a lot of good like fats in as well. Being careful with not doing a lot of high carbohydrates because that like glucose spike can also throw you off with that change in that gut brain axis. And then we like are good with like recommending melatonin afterward for sure, just to help with managing sleep and making sure you're getting a sufficient amount of sleep, especially because a lot of athletes post concussion will have difficulty like staying asleep,
Mm,
depending on what's going on. So those are kind of like our general recommendations afterward. Um, and just like a general, like kind of like anti inflammatory type diet. Because we know even like without a concussion, just like a post fight, like your body is trying to heal and it's in a high inflammatory state. So if you can manage that as much as you can with your diet, that's the details of that. Again,
mm.
I'm gonna hand off to a true specialist. Um, but yeah, those are kind of the main things that we look at too, especially and like including like probiotics to help with those gut issues that can happen afterward because of that like dysregulation in your gastrointestinal function and motility
Yeah.
and all that.
What would be some like low hanging fruit straight after a concussion for you?
Like management wise, yeah. So right after 24 hours, chill. Get off your phone, get off of the TV. Don't go hang out with people. Don't drink alcohol, which is really hard after a fight, especially if you have won.
Yep.
But that's going to really perpetuate that high inflammatory state. Um, and it's not helpful for healing in general. So first 24 hours, keep it chill. Don't aggravate symptoms. We're not trying to train or push into anything.
Mm,
After that 24 hours, go on a walk. Anything, go on a walk. Try not to push into symptoms. Those are the low hanging fruit. And then handling that nutrition piece, right? Like that doesn't take a lot of thought or thinking, doesn't require you to go outside or do anything. Just doing that management there. And then not being afraid to reach out to
yeah.
somebody if it's not going right, right? Because in reality, you should be starting a return to play progression after that 24 hours, right? Like you should feel like you could go on a run the next day. If you don't feel like that, right? It's kind of different with our, right? Like if we have like full body other issues going on, right? I get you're not going to run. But if,
Yeah.
you're a basketball
Especially
player
those
or a
calf
football player,
kicks.
oh my gosh, that is probably the worst things I've seen are just the shins of these
Mm,
athletes afterward. It's insane. That's the
okay.
craziest thing by far. They look broken and they're not, and it's insane.
That I like. I wish I could speak to you like for multiple episodes because like there's so much that we can dive in, like concussion.
Right.
Because I knew you that's the your speciality. Like I really
Mm.
want to pick your brain on it, but I think there's so much to be said on like shin kicks or calf kicks, quad kicks, and then ribs because that's quite a prevalent thing for
Hmm.
for the UFC, especially when you get those like little liver shots. Like what do you do then? Um,
Mm.
I wish we could keep going.
I know, right?
What would be like some key pieces of advice that you would give physiotherapists wanting to come into the industry?
So biggest thing is be humble and open-minded. You are, especially in sports in general, as a physical therapist, you walking into an athletic training room or a strength and conditioning room, like that's not your space, right? Like that's not like your space yet. And you have to learn as much as you can. So, like when I walked into an athletic training room, I'm there to be, how can I help you to my athletic trainers? What can I do for you? That is the best way. And same thing with strength and conditioning, right? Like, I'm here. What can I do for you?
Mm-hmm.
Picking up plates, putting towels, like those little things matter as a physical therapist because we aren't exposed to that sports realm like a lot of other um, like professions are. And just being open minded that you don't know everything and
Mm-hmm.
everybody has their place in an athlete's recovery, rehab, performance just in their whole journey of why they're there and just recognizing your gaps. And that's the beauty of interdisciplinary, just like how Becky said, like these people are here to fill the gaps in your knowledge. I don't have to know everything. I
Mm-hmm.
shouldn't know everything because that's just going to be superficial level of knowing everything and that's freaking useless. Nobody wants that. So that's kind of my advice that I would give to physical therapists is take a step back, be open-minded, learn from everybody, and that will help you find your place better and show where your value and your worth is
Mm-hmm.
a lot easier to be able to collaborate as effectively as possible.
100%. One of the first things that I said in my introduction when I coached at the University of Washington was, "Hi, my name's Manny. I'm 20, whatever I was." And when it came to like what my goals for my time there was, I was like, "I'm here to make your life easier."
Mm.
And it's just that mentality of just being a sponge, just absorbing everything that you can. I think that's amazing advice. If you want to, um, what's the word I'm looking for? If you want to plug anything, uh, it's very early here, very early.
I know, I know.
Um,
Yeah, impressive. You made it this far. Pretty good.
so yeah, if you want to plug anything or just where people could reach you,
Yeah, I have nothing to plug. Maybe one day I'll have something to plug. But yeah, if you just wanna, if you ever want to get in contact with me, probably Instagram is the best way. You can just shoot me a DM at Olive Abdoo. Yep, right there. Yep. So always, again, like I said before, I pretty much respond to any and all contact. So that would be the best way to reach me.
perfect. Thank you so much for coming on, and I do appreciate the time that you've sort of taken to walk me through your protocols and everything that you sort of analyze and look at in a concussion standpoint.
Absolutely. Thanks so much. It was such a pleasure, Manny.
No, appreciate you. Thank you. Peace.